Welcome to the Rehab Links Secrets to Success podcast. I'm your host, Lisa Chase, and today I'd like to welcome Dr. Lisa A DeStefano to our show. Lisa, welcome.
Thank you. Wonderful to be here.
Well, this is certainly a nice opportunity for us to talk further. Dr. DeStefano is a board certified family medicine physician. She's in Lansing, Michigan. Her and I met many years ago and have been teaching at Michigan State together. And she is board certified in neuromusculoskeletal and osteopathic manipulative medicine. And I am eager to learn about some of her tips. I certainly have learned a lot from you over the years and us teaching together. But this gives us an opportunity to share, with our listeners a little bit more about Michigan State and about, your journey as a physician and as a professor at Michigan State. So let's just jump on in and have you tell us a little bit about, you and your background.
Well, thank you. I was born in Detroit and raised in the Upper Peninsula of Michigan. So I've pretty much been a Michigander my whole life.
Mm-hmm.
I was always interested as a young person in how things function, how things work. So I was the kid that was taking the toaster apart just because the cord was a little bit frayed and I wanted to fix it. I had a VW bug that I completely took apart and put back together. I was just really curious about how things work. So I was also involved in chemistry quite a bit. I like chemistry. I love biochemistry. I love physiology. I love biology. I loved human systems. And so when I went to school up in the UP, I spent 3 years getting 2 associate's degrees simply because I couldn't really leave home. It was a comfortable area for me to live. So I got an associate's in science and one in arts. And when it came to moving on with my career in college, I was accepted to Michigan Tech, which is up in the UP, and also to Michigan State. And I thought the pathway for me would be chemical engineering. But when I finally decided to come down to Michigan State, because I figured if I didn't get out of the UP, I would never get out of the UP or northern Wisconsin, where everybody seems to stay from my hometown. So I came down to Michigan State in 1985. And I've been here since then. I failed miserably in chemical engineering. I really couldn't do the math. So I moved on to physiology, get a bachelor's in physiology. But along the way, somewhere, I wish I knew who it was in the moment it happened, but I don't, unfortunately. It was really a serendipitous moment for me where someone approached me and told me about osteopathic medicine and that Michigan State University had one of the premier colleges of osteopathic medicine right there on campus. And within a few days, I was in the office of the dean of admissions with my transcripts all laid out saying, hey, do I look like one of your graduate students? And she said, sure, take another biology course and apply. So I applied and I got in. And it was one of those situations where I think it was more of a spiritual God thing because I never really realized when I applied to the College of Osteopathic Medicine that I was going to be, I really didn't kind of grasp what it meant that I was going to be a fully licensed physician. I was just excited to be able to learn more about biochemistry and physiology and function. So throughout my years at Michigan State, my early years, I knew that osteopathic manipulative technique and osteopathic manipulative medicine or manual therapy was a part of the curriculum. It's a core part of the curriculum for the first 2 years of medical school. And I was like everyone else, trying to figure out how to pass my cardiology exam in my systems courses, and still, enjoy learning about the musculoskeletal system and how to do these techniques. And for me, it was all about technique because that's how we were taught. So along the way, I met and subsequently married John Vredevo. And John Vredevo was the co-author of the book with John Upledger that John Upledger wrote called Cranial Sacral Therapy. And I was a first year medical student. John Vredevo was someone I met at church. I really didn't know much about cranial sacral therapy or cranial osteopathy at all at that time. John Vredevo had a master's in fine arts from Pratt, and he was at that time teaching a course in like the natural progression of design in nature. It was just basically a design in nature course. And Diane Upledger, John Upledger's wife, was taking the course and was audio taping all of his lectures and would bring them back to John Upledger. And one day John Upledger approached John Vredevo because they were on the same campus. So John Upledger was at Michigan State at the time, teaching at the college. And this was back in the 80s, long before John Vredevo and I met. So they got together and they started collaborating on the design of the cranium in nature. And so when John Vredevo and I met, he wanted me to get to know John Upledger. So they reconnected as colleagues. So I spent the first 2 years, actually the first 4 years, on and off, back and forth to the Upledger Institute, and was working in the institute with many people. And I met wonderful people like Susan Trider, who's a physical therapist that might still be at the Upledger Institute, but she was there at the time. And I met lots of wonderful people. And that's where I really got my first exposure to physical therapy in the role of a physical therapist in the care of patients. And I also generated a love for cranial osteopathy, cranial work, cranial treatment. So when I graduated I was fortunate to have the opportunity to do an osteopathic neuromusculoskeletal residency at Michigan State that was integrated into my family medicine residency. It was a 4-year program, and got hired at Michigan State in 1997 as faculty in the College of Osteopathic Medicine in the Department of Osteopathic Manipulative Medicine. So that's where really my journey started, and I've been learning about patient care and the musculoskeletal system ever since. It's a long story.
Yeah, and you obviously had the opportunity to work with Dr. Greenman for many years, and then work together with him to write the Principles of Manual Medicine book, which you have then subsequently edited and also are re-editing with former Mark book out, which will be coming out. Is it next year?
Yep. It'll be out next year. Yeah, it's a real pleasure to for Mark to help me with the 6th edition of Principles of Manual Medicine. And Phil would be very proud to have Mark. He was Mark was a big influence on Phil Greenman. In fact, the 3rd edition, I edited the 4th, 5th, and now the 6th edition. The 3rd edition of Principles of Manual Medicine. Now, this is a course pack. The book was never meant to be a formal, textbook on manipulative medicine. The book was really meant to be the course pack we use in Michigan State University College of Osteopathic Medicine's Manual Medicine series. Mm-hmm. And that Manual Medicine series started in the 70s. As soon as the school hit campus, that Manual Medicine series started, and Phil Greenman really was Phil Greenman and Paul Kimberly, John Burdillon, John Manel. So you can see there was kind of a diversity between the MDs and the DOs at that time. all put these courses together to teach osteopaths, to teach MDs. And then it expanded because of the influence of certainly Mark Bookhout and Carl Steele as well.
I'm going to pause for just a second because my little doggy is going crazy. So hold on one. Okay, thanks. Sorry for that little interruption. But okay, so now I would love for you to share a little bit about the Michigan State program, because it certainly had made a huge impact on me and my clinical practice. And it absolutely made a huge difference in getting great outcomes, which is kind of about, why the listeners are tuning in to kind of learn a little bit about that. So I'd love for you to share, because I know you've had a lot of involvement with the program, both as a chair and as teaching throughout the years.
Yeah, I was as a resident. So I started my internship year in 1993 and my residency in 1994. And my first couple years in my program, I worked with Bob Ward. He was my program director. Robert Ward does a lot of myofascial. He taught a lot of myofascial release courses at Michigan State within this manual medicine series. He was the originator of the integrated neuromusculoskeletal release, which is very cool. It's not myofascial release in the sense, but it's a nice way to enhance and integrate the nervous system into the muscular changes that we feel with myofascial release. So, and I also was able to table train in the Principles of Manual Medicine course, and then subsequent courses after that. So I got to work with Phil Greenman quite a bit. But I also was fortunate because I was in this residency, right? He was in patient care. He was seeing patients in physical medicine rehab, again within our practice plan here at Michigan State University. And he was just doing manual therapy and manual manipulative medicine on his patients. So I was able to hang out with him in patient care quite a bit. So in the first year of my residency, or the first year and a half of my residency, I was not allowed to hang out with Phil. I was not allowed to work with him in his patients because Bob Ward really wanted to inundate me with what he was doing. Plus, I really had to build up my own patient practice, and we were busy from the get-go with patient care, and there was a lot of patients that needed to be seen. But it was very confusing with Bob Ward because he really couldn't give away his secrets about how he was getting people better. He wasn't clear. He wasn't the teacher that Phil was, in the sense that he was excellent with his hands, and he could see through the system, right? He could see what was going on, and but it wasn't clear to someone who was just learning the material how to get the results that he was getting. So I never forget it was a bit frustrating for me, even though I was getting good results. I wasn't really clearly, I'm the person that needs to take things apart and put them back together, right? In my mind, I'm pretty organized and systematic and precise in the way that I look at the world. And it was a bit frustrating for me. So I would never forget the first week I worked with Phil Greenman. It was PM&R. We were on the first floor of the clinical center, and it was the Friday, the very last day of the week, and we were done with patient care. And he came in, he sat down next to me, and he says, "So do you have any questions for me about this week? What'd you think?" And I looked at him, and then I just started bawling. I started crying. It was so elegant, the way that I could see what he was doing. When he was doing muscle energy technique, I got it. And he was telling me precisely the indications for what he was doing and why and how it worked, and the way he was communicating to the patients. Really, it was one of those things where you see something that's so beautiful, it moves you. It was one of those moments. And I was just totally, he's looking at me like, oh boy. So
no crying in manual
yeah,
medicine.
I know. From that moment on, I kind of pretty much, I was like a little tail on Phil Greenman. I would follow him around and watch what he did. And it was such an honor for me to be able to sit in the back of the room and learn from not only him, but also all the wonderful individuals that have honored the manual medicine series throughout these past years. And you know, I remember I don't remember how you and I met specifically. I know it was at the series. I don't remember if you were taking the courses or if you were already involved in these courses back in 94, 95.
Yeah.
But I know that I think Mark started in the early 90s. And then the exercise prescription course got built around his model. And I remember that when I edited the fourth edition of Principles of Manual Medicine, there were a lot of the exercise prescription material was in that book, but in it I knew it came from Mark, but it was never credited to Mark. So that's why we pulled it out. I pulled it out of the fourth edition. Mm-hmm. And then I credited Mark in the fifth edition. Because I really didn't quite understand what was going on with that material. And that's why I really felt very strongly that I needed to ask him to co-write the book with me in the sixth edition. So that's where we're at.
Yeah. And I know for Mark, him and I were very close and obviously did a lot of work with Rehab links and in teaching and the exercise course. And it was very important for him to leave a legacy. And I know that co-authoring that with you really meant a lot to him. And so, you know, thank you for asking him to do that. And for the listeners out there, so at Michigan State, this is a manual medicine series that is both taken by the residents that are going through the program, but is also available to physicians, physical therapists, mostly. There are a few other healthcare providers who have taken the courses, some nurse practitioners, and maybe some others that I'm not thinking about. But it is a wonderful series that starts with the principles of manual medicine, where we really lay the foundation of osteopathy and being able to assess the whole system, and then various techniques. And then each course is then broken out where you can, if you want to learn more about craniosacral, muscle energy, there's a high velocity course, obviously the exercise course, and I'm probably missing some, an extremities course. And then that could lead to, if you're a physical therapist, to the functional manual medicine certification. So for any of the listeners out there that are looking to improve their manual therapy skills and just be a better clinician and better decision maker, I would highly recommend that you take those courses and look into the series. So well, with that, let's jump into, because I'm sure you have some really great, valuable tips on how you, over the years, have really, you know, been able to get great outcomes. And I'd love for you to share some of that with our listeners.
Well, one of the things that I think has made a huge impact on my clinical outcomes is what I learned in the manual medicine series, and that is that the musculoskeletal system is really complex. And you just can't do some manipulation and expect that the patient is going to get better. And so what we try to do with this course from you know, of course, every course is very reductionistic. We start very reductionistic, and then we build on the normal function of the musculoskeletal system. And that's really what we're trying to develop. And that's what's really helped me, is to understand the normal function of the musculoskeletal system, to understand the role of the joint and the neurology within the joint, and how that joint dysfunction is going to influence the dynamic stability of the system.
Mm-hmm.
from a micro to a macro level, and how it integrates in the active, passive, and neural subsystems, and how they are all going to be influenced by that joint dysfunction. And so it's really been the course. It's the course series itself has really been the one thing that has really impacted my clinical outcomes. It's really made me dig further into the various aspects of neuromusculoskeletal function. And I've reached out to and have learned from many, and continue to learn from more and more folks that clinicians that have a little piece of the pie, right? And just if you think about reading Butler's work and reading Barry Weich's work on neurology and the arthrokinematic reflex. And so those are all aspects that I think are really have helped me more than anything else. And that's what this course series does. Additionally, I think that adding the cranial piece has really been the key. And cranial at Michigan State's taught much different than in other programs, because we're really going to break it down to the clinician's perspective. We're going to get the anatomy and physiology, but we're going to shorten the course to make it very clinically usable. And the way we do that is we're really going to just open the head, make sure that the head has the compliance it needs. And we find that that is really the key to shortening your visits with your patients and getting a lot of work done. It's very clinically, a lot of clinical correlation with the cranium. And I've found that I used to hate treating headaches, chronic headaches and migraines, because I felt so useless. It just was like, manual medicine doesn't really work for headaches, right? So until I learned that cranial system early in my career, and I've really been I use it almost every day on my patients.
Yeah, cranial is very impactful, not only for head and neck issues, but can really translate to issues, further down the chain, for sure. So it does open up your eyes. If the listeners have not taken any cranial, I would definitely encourage you to at least take some kind of introductory course. If you're not interested in really fine-tuning your skill in that, then find a clinician that really does it, so you can partner with them. So you could, add that into a treatment plan if it was needed. So yeah, I'm with you. And I think the neurology piece is super important, right? When I first started taking the Michigan State stuff too, I think I was, as a physical therapist, certainly we learn about the nervous system, but we're learning a lot about muscles and joints and how to move, how to move joints and how to get muscles to function. And it wasn't until I took the muscle energy and paired that with the exercise course that it really, like, the light bulb went off for me on how we're impacting the neurology in the system, and how that can change how people move and how muscles are firing, either too much or not enough. And then obviously pairing that with the best exercise prescription with what you're doing with your hands-on really gives us, those better outcomes. So that's great. So I know that, you teach at Michigan State. And so are there things specifically, and also in the College of Osteopathic Medicine, right, with the residents. So are there things that your students find particularly valuable that they're saying to you, wow, like, you've really given me some insight on whatever that might be. You help the light bulb come on for students. Is there something from that realm that you can share?
Well, as an educator, we start with this concept that, we just we start with this concept that it's all about the technique of manipulation, and that's a flaw in the system.
Mm-hmm.
And so I think with the students really and the residents really, when they come into the residency, they're expert manipulators, and they make people feel good, like fellow peers, right? Mostly, and family members. But they really don't understand the indications for when to use manipulation. So the concept is, well, it hurts in this location or region of the body. I'm just going to manipulate that area,
Mm-hmm.
right? That should make it all work. If you get something
Right.
to move or get it to crack, or so, and it's broader than that. It's when you really think about that active, passive, and neural subsystem as Panjabi defines it, we start to see that manipulation is a tool in order to improve function. If you improve function, the pain has to go away. I mean, if a good example is, hamstring injuries, right? Hamstring pulls, hamstring tears, hamstring pain, hamstring tightness. We all want to just stretch the hamstring, stretch the hamstring, stretch the hamstring. And really, that's destabilizing the pelvis even more. If we think about what the hamstring is, it's a primary hip, it's a big hip extender.
Mm-hmm.
And the reason why that hip extender is working harder than other hip extenders is because the fact that the gluteus maximus, which is the primary stabilizer and the hip extender, is really, from a timing perspective, is not really functioning well. And so the hamstring stays on longer, and it sends fibers across. It kind of balances, right, this tensegrity of stability from the fascia, which is a very critical piece as well. It's trying to stabilize the pelvis. And so you really, if the hamstring's trying to stabilize the pelvis and you're trying to stretch the hamstring, then you really are going to destabilize the pelvis, right? So the key is to treat the sacrum, get the glute max working, and the hamstrings have no choice but to shut down. That is a continuum throughout the body. We look at the body. When I see pain, I'm looking at it from an overuse myofascial or muscular pain syndrome perspective. Even if it could be psoas or iliocostalis or erector spinae, regardless of what the muscle is, the reason why the muscle's sore is because it's working too hard to either in pronation or supination or somewhere in that chain. And I think just for the students to grasp the true indications for manipulation is to shut down, is to turn on the stabilizers. So those muscles have to shut down. Really is quite remarkable to see that transition. And then they really get going, right? That's what really gets them started. So
Yeah, that gets them excited for sure. Yeah, we see that a lot in the exercise course too, the light bulbs going off. So, okay, wonderful. So, is there anything else of value that we would like to offer? If anybody wants to learn more about Michigan State or take a course that you would like to share?
well, I think that you don't know what you don't know until you try to go kind of go outside of your realm of learning. The Michigan State courses are really unlike most manual medicine courses. We find that, I mean, we've kind of honed the courses since 1970. Um, and I think that they build on one another, but I would highly recommend taking the principles course, because you're going to get a good flavor for why we do what we do and how we do it and why we do it differently. I think that you'll understand when you take some of these courses the role of the cranial system, and when to take the cranial system and why to take the cranial system. I mean, one thing that Phil always taught me is that if you have an upper cervical complex dysfunction that you're struggling with, it's a cranial problem until proven otherwise. TMJ, vertigo, so many other things that we don't think about that fit into that model. That it's a nice integration to the musculoskeletal system, and it really is. If it's the place and it's the way to really begin to understand normal musculoskeletal function, which is what you want to achieve in your patients. It'll help you with patient time. It'll help you with your clinical skills. It'll allow you to work within the realm of your schedule to get a patient in and out the door. It certainly has given lots of physical therapists the opportunity to go into private practice on their own, cash-based practice, because we all know that even in musculoskeletal world, even in the physician world, right, the healthcare system is pretty broken when it comes to helping patients with musculoskeletal problems get better and achieve normal function.
Yeah, definitely. Agree with that. Okay, well, this has been wonderful insight. I learned a few new things that I didn't know and was kind of reminded of some others. So thanks for sharing with me and with our listeners. If people want to learn more about you or Michigan State, how can they find you?
They can email me at dstefano@msu.edu. Also, they can go to com.msu.edu, and then look for the CME program within that, or just Google manual medicine series at Michigan State University College of Osteopathic Medicine.
Excellent. And I will definitely put that in the show notes. And I so appreciate you joining me today. So with that, I'm going to sign off. And until next time, keep getting great outcomes.